Assalamu alaikum. Today, the topic of our discussion will be the anti-malarial drugs. But before discussing the drugs, I will talk about its transmission and its life cycle. Because with the help of life cycle, it will be easier for us to understand different drug site of action. So, starting from its transmission, Anopheles is the mosquito, and in its saliva, they contain different species of malarial parasite. Now, five species of plasmodium basically are responsible to cause malaria. Those five species are the plasmodium vivax, plasmodium ovale, plasmodium malaria, plasmodium falciparum, plasmodium knowlesi. The plasmodium knowlesi was recently discovered that it causes malaria in human beings. It was generally discovered that knowlesi is responsible to cause infection in monkeys, right? But recently it was discovered that it also causes malaria in human beings. Okay, now coming onward towards the life cycle of malarial parasite. So this is the anopheles mosquito, which is responsible to cause the transmission of sporozoid of different species of malaria. In its saliva they contain sporozoid. When it bites a person, it injects sporozoid into the person bloods. Now when the sporozoid are there in the blood, they enter into the liver within minutes, right? In the liver, they either convert into merozoid or they either sleep, right? The sleep phase is called as the hypnozoid stage, or you may call as the dormant stage. Okay, once when the sporozoid enter the tissue, if they replicate and they convert into the merozoid will again enter into the blood. But at this time, it will not be there in the blood, rather it will enter into the red blood cell, right? And in the red blood cell, they will replicate, and then the red blood cell will rupture, leading to the sign and symptoms of malaria, or they will either form the gametes. Now, important to note over here is that the gametes will not fuse in the person or in the human beings. Because we discussed we have two kinds of host. One is the definitive host and one is the intermediate host. The in definitive host, the sexual cycle occur, while in intermediate host, the asexual cycle is there. Now, in the case of malarial species, the human being act as an intermediate host. I mean, the species do asexual cycle in the human beings, whereas the sexual cycle occur in the anopheles mosquito, right? So the malarial parasite host, definitive host is the female anopheles mosquito, whereas its intermediate host is the human beings, right? Okay, now uh, if we look at the graph, we can find that one here is the uh, erythrocytic stage, the stage where in which the sporozoid or merozoid replicate in the red blood cell, right? As erythrocyte, the other name, or medical term, we call red blood cell as erythrocyte. So here, as the parasite replicate within the red blood cell, therefore they're called as the erythrocytic stage, right? Okay, the other is the okay, now this is the erythrocytic stage. Now these two stages, they occur outside the red blood cell, so they're called as the exoerythrocytic stage. But in order to differentiate this stage from the latent tissue form, we call this as pre-erythrocytic stage and this stage as hypnozoid stage, right? Means they both occur outside the red blood cell. But in order to differentiate this stage, the conversion of sporozoid into merozoid, from the hypnozoid stage in which the sporozoid basically sleep, right? The dormant stage, we called this stage as the dormant stage, the hypnozoid stage, and this as pre-erythrocytic stage. Pre means before, means this stage is before the erythrocytic stage, right? Okay, and the other is the gametocyte stage. Now Okay, if we discuss different kinds of drugs, the first one is the primaquine. The primaquine is tissue schizontoside. You can say liver is a tissue, this one is blood, right? So primaquine is the only drug that will inhibit this stage, the hapnozoid stage, and the gametocyte stage. Now, we know that gametes are basically involved in the transmission of malaria. So, if we are going to inhibit this stage, we can prevent the transmission of malaria. Okay, this stage is a cause of malaria. So, if we are going to inhibit the pre-erythrocytic stage, we are going to cause, we are going to cure the cause of malaria, right? Okay, now this is the latent stage or hapnozoid stage. From the hapnozoid stage, the sporozoid can reactivate again at any time. It depends, and the reappearance of the malaria is called as the relapse. So in order to prevent the relapse, we are going to give the hapnozoid stage. And in malaria, basically, what we discussed, that one is febrile illness and one is non-febrile illness. In febrile illness is an illness which is accompanied by fever. So when a fever is gone, again, if in some cases or by some means, if the sporozoid activate, it will again cause the malaria, right? So the relapse will occur. So in order to prevent the relapse, we are going to give the primaquine. So this stage is used to inhibit, if we are going to inhibit the relapse to occur, right? Okay, so primaquine is the only drug that is tissue schizontocidal, and it is the only drug that inhibit the pre-erythrocytic stage, the gametocytic stage, and the hapnozoid stage, right? Okay, now important to note over there is that primaquine causes hemolysis in glucose 6-phosphate deficient patient. The reason it is contraindicated in infants and pregnancy. Now we're going to discuss the erythrocytic stage. If you're going to cure the malaria, we discussed that when merozoite ruptures, right, at that time the sign and symptoms are shown. So in order to cure that sign and symptoms, we are going to give these drugs. So these drugs will cure the sign and symptoms of malaria by inhibiting the erythrocytic stage, right? Okay, so one we have rapid acting drugs, the other is slow acting drugs. How we are going to remember the rapid acting drugs? Remember it from the word machar. In Urdu we call mosquito as machar. So M mefloquine, A atovaquone, C chloroquine, halophantine, artemisinin, and rescue. Rescue is a pharmaceutical name and its chemical name is quinine. Now the other one is the slow acting drug. In slow acting drugs we have proguanil, pyrimethamine, sulfadoxine, doxycycline, and clindamycin. So these are slow acting drugs: proguanil, pyrimethamine, methionine, sulfadoxine, doxycycline, and clindamycin. Okay, now we are going to take this chloroquine, which is rapid acting, and it act by inhibiting the erythrocytic stage. That this is the chloroquine. Now chloroquine is a prototype drug. What does it mean? It means that all the derivatives of chloroquine will have same chemical nature and will have same mechanism of action. The mechanism of action of chloroquine I'm going to discuss in a few seconds. But before discussing the mechanism of action, remember that it is synthetic for aminoquinoline. It's a chemical structure for aminoquinoline. Now, the resistance to chloroquine is common with P. falciparum, right? And this chloroquine is a drug of choice in acute attack of malaria. As I mentioned that it is used to cure the sign and symptoms of malaria. So whenever the red blood cell rupture, at that time it just began to show the sign and symptoms, and therefore the reason we're going to give the chloroquine in order to prevent the acute attack of malaria. Now, okay, now if we talk about its mechanism of action, So malarial parasite basically uses the amino acid as nutrition, right? So hemoglobin, when we break down the hemoglobin, we have globin chain and heme. The globin chain will lead to the amino acid. This amino acid will be taken up by the parasite as a nutritional food. But here the problem is with heme. The heme act as a toxic to the parasite. The heme are toxic to the parasite. They will kill the parasite. So what will the parasite do? The parasite will polymerize the heme into hemozoin. Alright, so the heme will be converted into the hemozoin. This hemozoin is now non-toxic, right? And in this way the parasite will replicate. But the problem arises when we give the patient the chloroquine. The chloroquine, what the chloroquine do? It basically inhibit the polymerization of heme into hemozoin. So if this polymerization is blocked, what will happen? The heme concentration will increase. So if the heme concentration is increased, the toxic effect will increase, and it will do what? It will kill the parasite, and it will kill the parasite. The parasite is killed, but we are cured. The person is cured from the malarial parasite. So this was all the mechanism how the chloroquine is going to act, and how the chloroquine is going to kill the parasite, right? It just inhibit the polymerization of heme to hemozyme. And that was all from my side. I hope you all understand a little bit. Thanks for watching, and if you like my videos a little bit, just subscribe it, share it with your friends. It gives me a great pleasure. Thanks for all. Allah Hafiz for now.